nuclear fragments, which are readily, safely, and efficiently emulsified in the central part of the anterior chamber. I'm sometimes concerned, though, about the potential of danger for the anterior capsular rim when trying to engage a periphery of the nucleus with the large chopping instrument. This danger is shown in schematic profile here. A way to avoid this is to start the procedure with the chopping instrument central to the capsular rhexis rim. The chopping procedure could begin by pressing posteriorly here to engage the fragment. However, I think that this would overstress the zonules. Instead, I use a technique whereby the phacochopper dissects between the epinucleus and the nuclear fragment to place it in the periphery in preparation for chopping, but this places the chopping instrument tip in close proximity to the peripheral capsule. Instead, you can use vacuum to engage the nuclear particle and pull it centrally so that the chopper doesn't have to proceed as close to the capsule to engage the nuclear periphery. This procedure is shown from the surgical microscope perspective here, in which vacuum draws a piece centrally, it's chopped, and then emulsified. A further continuation of this thinking led to the Seibel chopper, shown here in schematic profile, in which the rounded portion of the edge will be engaging the nuclear periphery, and the smooth ball, olive tip shaped at the end, allows for ready dissection between the epinucleus and the heminucleus. Notice the conformity of the round curved section to the periphery of the heminucleus, and notice the notch formed by the olive tip and the curved section of the shaft, which provides for ready engagement of this nuclear particle prior to chopping. The instrument is shown in schematic profile here, with the cross-section shown here showing the orientation and shape of the curved part of the chopping edge, and this schematic showing the perspective of a surgeon looking directly down on the instrument, showing the orientation of the chopping edge at about 45 degrees relative to the direction of the handle. The actual instrument is shown here from the surgical microscope, and it can be seen that the entire surface is very smoothly polished with the exception of the edge, seen edge on here. That's just at the inner curve of the instrument. The instrument is immediately useful in the procedure, shown here atraumatically handling the clear corneal wound lip while providing for insertion of the phaco tip to begin the procedure. The chopper is then inserted atraumatically via the olive tip through the side port incision to stabilize the eye while proceeding along with initial sculpting of the anterior epinucleus as an initial step that I use for any technique. In this case, a stop and chop maneuver will be performed as described by Dr. Paul Koch. The nucleus here has a relatively high density, as can be seen by the tongues of material that are left after each phaco pass. A central groove will be created, and then the nucleus will then be cracked into two segments. The Seibel chopper at this point is providing countertraction, and now at this point is providing rotation. Because the curve allows the ball to be placed in the mid to posterior part of the face of the nuclear groove, it allows for optimum placement against this higher density portion of the nucleus, such that the chopper will push and rotate the nucleus without penetrating it. The same advantage is shown here for a cracking maneuver by placing the ball at the mid to posterior portion of the groove rather than at the more anterior part. The large surface area of the olive tip further aids in this maneuver. The heminucleus will now be engaged with the phaco tip. The vacuum will be used to draw it centrally, and the chopper can then engage the periphery of the heminucleus, performing an efficient chop, and here seen again. As the pieces are drawn centrally with vacuum, the chopper rides lightly over the anterior surface of the heminucleus, and as soon as the heminucleus is pulled centrally enough so that the olive tip can clear the periphery, the chopping instrument is then allowed to drop posteriorly slightly to allow for positive engagement of the periphery, conforming to the curved part of the shaft. Here the epinucleus is shelled off, and the small chopped fragment is readily emulsified. The epinucleus is then removed with flipping, as described by Dr. Howard Fine, in which vacuum is used to pull toward the surgeon, as the instrument is then used to push away from the surgeon, flipping the nucleus upside down for readily removing it in the safest center part of the chamber. Again, vacuum is used to pull toward the surgeon, as the Seibel chopper in this case is used to push the inner surface of it away from the surgeon, effectively flipping it over and pulling the superior portion of it inferiorly. The large surface area and smooth outer radius of the Seibel chopper allows for effective pushing and manipulation in this technique rather than penetrating and losing control, as would be the case with a simple blunt instrument such as a cyclodialysis spatula. Here's a technique showing a tip that I've developed called the flathead phaco tip. It involves a phaco tip that involves the distal 2 millimeters squeezed down to a rectangular configuration. With the tip in the horizontal configuration, a central square bowl is created, and the tip is then turned to the vertical configuration to create fault line channels in the central densest part of the nucleus. The Seibel chopper is then introduced, and a crack is produced after just 2 passes with the phaco tip in this fashion. The same process will be seen here again with the tip in the vertical configuration. 2 passes are created side by side to create a fault line channel. Seibel chopper and the flathead tip are then inserted into the channel, pulled apart, and a crack is produced. This technique can be used to either create 2 heminuclei or 4 quadrants. These heminuclei or quadrants can then be subsequently readily chopped, as was seen in the previous techniques. And as will be shown here, this particular nucleus is a very fibrous type of nuclear sclerosis and will illustrate a further utility of the Seibel chopper. Note that even though a chop has been created, the fragments are still adherent in the center posterior portion. In this case, high vacuum will be used to engage this fibrous section, while the Seibel chopper is used to pull around the posterior connecting segment and sever the connection. Same thing will be seen here. High vacuum is used to bring the fibrous particle that's still attached posteriorly more centrally. The Seibel chopper is used to sever the connection. And here a simple chop. And again, readily chopping the very dense nuclei that's shown here. Yeah, this also shows a Seibel flathead tip in this white cataract that is only of moderate nuclear density. The anterior epinucleus is removed with the tip in a horizontal configuration. Tip is left in a horizontal configuration to sculpt the central bowl, while the Seibel chopper is used to stabilize the eye during sculpting. The tip will then be rotated into the vertical orientation to create the fault line channels. 2 passes side by side, enough room for the flathead tip and the Seibel chopper, here used in a cross action. It's very effective even in the softer nuclear density because of the large surface area provided by the olive tip, as well as the smooth part of the curved shaft. This allows good mechanical advantage in pushing moderate and soft density nuclei without simply penetrating them. This allows optimal manipulation for splitting and rotational maneuvers. Once 2 heminuclei have been created, again, this moderate density nuclear sclerosis is relatively easily chopped. Sometimes the more difficult cataracts to perform are the soft nuclei rather than the very hard ones. This is often the case, as can be seen with a mostly posterior subcapsular cataract, and the difficulty arises from the soft density precluding the possibility of effective control by pushing, cracking, or rotational maneuvers, because the second instrument often simply passes through and penetrates the nuclear material rather than pushing against it. In these cases, the Seibel chopper is very effective as a nuclear disassembly instrument by allowing dissection of the inner nucleus from the epinucleus, as can be seen here.